All right, my friends, today is a very, very special day. We have gone to great lengths. We have crossed the earth. We have dug. We have excavated. We have pulled from the archives one of the heroes of respiratory medicine, one of the heroes of pulmonary exercise, and one of the most diesel, buff, this is why I wear sleeves when she's here, just in case, Donna Wilson, who is a respiratory therapist, a nurse, a personal trainer, and an all-around guru who knows every centimeter of the respiratory system, left, right, inside, out, up, down, all around the town. Without further ado, Donna Wilson.
Hello everyone. Thank you very much, Noah, for that beautiful introduction. I would like to spend this time and talk about some breathing with you. I'm going to talk about why and how you breathe and some breathing exercises that might really help you in acute situations with exercise and for relaxation and rest. So let's think about this. You breathe because of the muscles of your chest wall. All these muscles here and your neck muscles are your accessory. The big muscle you have is your diaphragm. And that really is the big workload for breathing. They have to stay strong. So if you have an acute event or you're short of breath, you can depend on the endurance of those muscles. So that's why I feel so passionate about why it's so important to exercise when you have a lung disorder. It also is important, and we'll get into this as time goes on, but every muscle in your body takes oxygen. So therefore, you have to keep your whole body in the best physical shape to breathe the easiest. You know that you're breathing in oxygen. Oxygen comes into the lungs, pumped out to all parts of the body. Then the carbon dioxide and toxins that come out, and you breathe out. But what was really important is you know that breathing out is more important than breathing in. Breathing in will commonly happen all the time. Change in atmosphere pressure, lung pressure, the air just goes right in the lung. But what we really want you to do is work on extending that length of time you breathe out, and not hard. One of the things that I found is that when you say, if I say to somebody, breathe out, they go, now, if you might have heard that high-pitched noise in me, well, I've just collapsed a lot of my small airways. That's not what I want. I want you to breathe in, and I want you to blow out slowly through pursed lips so you create a little back pressure in your cheeks so those small little airways stay really popped open. So you breathe in, and you just breathe out. Nice and long and slow. You don't want to bear down. When you bear down to breathe out, like when you're really coughing, what happens is you're not really exchanging good airflow. You're not get the oxygen and the carbon dioxide. They almost like sort of are in static position. They're not moving because you're holding everything really tight. So the first breath I really want to teach you is a relaxation breath. And I feel very strong that you want to always breathe in through your nose for the relaxation breath. Now, the easiest way to know is if you take your hands and put your fingertips underneath your ribs and just sniff. Just sniff. You'll feel a muscle move down there. That's your diaphragm. The diaphragm goes from the middle of your back, attaches into the vertebrae, around, and it's a big dome. Some of us, well, it gets a little flatter with time and different diseases, but overall, it's still working. So what I want you to do is breathe in if you can. When you breathe in through your nose, don't feel frightened that you don't feel like you're getting a big breath in. So breathe in, hold for a second, and now breathe out through your lips. Long and slow. What's nice about this is you do 3 or 4 of those breaths. You could be in a sitting position, you could be in a slight, with your head down, in a lying position, but most importantly, feel the breath. Now, one of the things that I do I've done with a lot of my clients and patients is that I'll put my hands on their lateral chest wall when they're breathing. And you can actually do it yourself. Think about putting your thumbs up near your armpit and your hands on your ribs. Now breathe in through your nose And as you breathe out, just give some very gentle pressure with your hands down on your ribs to squeeze the air out a little bit more. Now, as soon as you're ready to breathe in, let go, and you'll be finding that you can take a bigger, deeper breath and breathe out. So that's a relaxation breath. You always want to do 4 or 6 of those in a row. I have another breath that I find that I used to call it my diaphragmatic aerobic breathing exercise. Now, and I have to tell you, physicians have come to me and said, how come the patient looks so good, they know how to breathe? It's because every little striation of their diaphragm, I've gotten them to move. So, what you do, we now call it sniffles, which is what it is. You put your hands underneath your ribs, and I want you to just breathe in and out of your nose. Now, initially, start slow. Now, if at one point when you're doing that, and you feel like you're breathing in, and all of a sudden you feel like, oh my God, just stop what you're doing and just breathe out. The goal is that you practice this, so your goal is that you could do 30 seconds to a minute. And the ultimate goal is you could do it quicker, like this. So that then you'll get strength in the diaphragm. It's a simple way to strengthen the largest muscle of the diaphragm. Now we incorporate some movement with our breathing. So the first thing I want you to do is put your arms out to the side. And I want you to put your hands, palms forward. I want you to breathe out. Arms are forward. Now I want you to breathe in through your nose and breathe out. And just breathe out, opening that chest. Breathe out as you go forward, as long as you can. And I want you to breathe in. You want to do this about 4 times. Now let's breathe out again. So breathe out for the count of 8. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in for the count of 4. 1, 2, 3, 4. Now stop here. Put your palms to the ceiling. To open the chest a little bit more, I want you to do some quick breaths out of your mouth and push your thumbs to the behind you. Now, let's blow out and breathe forward. And breathe in this time. And you might feel that you can open the chest just a little bit more by opening and stretching the muscles up here in your chest. So, and remember, the chest muscles, the shoulder muscles, your upper back muscles, they're all connected into that shoulder girdle. The next one, your hands, I call this a snow angel. I like it because you remember, you want to get this length of the muscles of the chest wall. You need to get them more flexible. So you have to breathe out to get them stretched. So if your hands are forward, your palms are forward, I want you to breathe out and put your arms up over your head and come back down. You'll automatically breathe in very nicely. Now breathe out again. Now, if you want, breathe in a little bit. And one more. Breathe out. Get those arms straight and stretch. And back down. Great. The last one I really want to talk to you about is what I call the healing breath. And this happens when you're doing some vigorous exercise, or you go out up a flight of stairs, or you went into a coughing spasm and you just can't catch your breath. What happens there is your lungs at this point might be a little overinflated. So I want you to take your chin and put your chin down to your chest and just breathe out. So when you put your chin down to your chest, you're relaxing all those neck muscles that are working overtime. So now blow out. Now all of a sudden in your neck, it's all going to feel a little bit easier. So breathe in through your nose, breathe out through your lips. Now the next time what I want you to do is breathe in through your nose and just go, Ah, like a big sigh. Now let me tell you how that found out. When I worked at Mass General many years, I did a lot of bronchoscopies to check airways. And what happens is when you breathe out and that air is coming up through your vocal cords, what's happening is your vocal cords are opening and closing. So when you let that air out, coming up, out through your vocal cords, what happens is that everything's starting to relax. Your heart rate goes down and your airways open up. So all of a sudden, you feel really calm and relaxed. So anytime you could use this. So breathe in through your nose and just go, ah. So those are my relaxation breath, my strengthening breath for the diaphragm, the stretching of the muscles of the chest wall breath, and also the ah breath, so as a healing breath. Try to use these in any of your times when you need to relax and you need to fill every air sac in your lung. You need to get the depth of respiration. That's what's important. So I hope this is helpful. Please write me if you have any questions. Thank you.